Thank you. Good evening, everybody. I'm Richard Landon. I'm one of the pastors here at Anona United Methodist Church, and we've decided to gather together a couple of professionals from our area to be able to talk about what's going on in Pinellas County regarding the COVID virus. And you might be saying, why? Why are we gathering these two gentlemen together? As I'm talking to people, I'm getting a couple of different responses. On the one hand, I'm hearing from some people that they're scared. Some people are frustrated. Some people are saying, is it even real? And I thought it'd be a good idea if we just pull together some people that know, that have feet on the ground, that could tell us what's actually happening, not just across the state or across the nation, but right here in Pinellas County. So on one side, I have Richard Schomp, who's over here on my left. Richard is 33 years as a first responder. He retired from the city of Seminole as a district fire chief after being there for 25 years, and he's currently the director of Sunstar Operations. He's a 29-year member of Anona United Methodist Church as well. So this is Richard over here. On this side, we have Scott. Scott is 42 years a first responder here in Pinellas County. He currently serves as the district fire chief for the Clearwater Fire and Rescue. He's a shift commander, supervising 8 different fire stations with 60 personnel that work underneath of him. He has disaster experiences. He's been deployed to the Hurricane Andrew, Hurricane Ivan, and the 1998 wildfires. He's an emergency manager in the past for Dunedin Fire and Rescue, and he's also a paramedic and a registered nurse. He's also from Anona, from the class of 1972, and one of the things that he put in his email to me as we were sort of laying out the biographies was that sort of reminded him of how old he is. Both of these men are truly members of United Methodist Church. And I want to thank you both guys for showing up tonight, taking time out of your schedules, realizing you're doing multiple interviews, and also that you're taking time away from your families and or your jobs to be present with the people that work with you. Why don't we just go ahead and jump right into it, Scott? One of the things that we've been talking about in our conversation as we were preparing for this was that a lot of times when we think about Florida, we think in terms of hurricanes as the disaster. And there's organizations that help us in the midst of that. There's first responders that we hear a lot. And we also hear about emergency centers. And sort of wonder what's the difference between those two and how is that impacting us in this particular moment?
So that's a great question. And Richard, thank you so much for having us. Thank you, tech team. This tech team has been all over this tonight. And hello, church family. It's great to be here. I wish I was looking out over our contemporary worship center and seeing you all out there in the chairs. I miss that. But we'll get through this. And I am very much looking forward to the time when we're all back together and we can worship together in person. So thanks for having us. Thanks for putting this together, Richard. One of the reasons we thought this would be a good idea is, look, folks, the news coverage of the global pandemic is just constant. 24/7, you can turn on the TV and pick up news coverage, but it occurred to us that much of it is focused on the nation and the state of Florida. And even with our local news stations, sometimes it can be a little hard to drill down to the county level or even down to our community level and find out exactly what is happening here and perhaps more importantly, what's being done about it. So we're glad to be here tonight to talk to you a little bit about the status of this crisis in Pinellas County. So Richard, the question was the difference between emergency management and first responders. Well, first responders, for the purpose of our discussion tonight, are law enforcement, firefighters, and paramedics. And as the name implies, we are the first to respond to emergencies, both on a day-to-day basis, and after a hurricane passes, the first to poke our heads out and say, okay, let's go take care of this. But you know, we can't do that. First responders can't manage, especially a situation like this, by ourselves. And so now we enter the world of emergency management. And there's some good news in what we have to talk about tonight with emergency management. Used to be called civil defense. Some of you probably remember duck and cover drills and fallout shelters. So civil defense eventually became what we call today as emergency management. You know, in 1992, Hurricane Andrew hit southern Florida and just wreaked devastation down there. And that revealed that we had some serious deficiencies in our disaster planning at the state and local levels. So the good news that came out of that was that state and local leaders committed to building a very, very strong emergency management system in the state and in local communities. They did that, and that has been maintained. Now, over the past couple decades, we've had how many hurricanes come through the state, impact various parts of the state, and we were learning from each one of those experiences and refining the plan and refining the lines of communication and the partnerships that are required to manage a disaster of that scale. Then in 2001, we had 9/11, and we realized that not all disasters are natural. And so again, we further revised our plans, and you begin hearing things like threat level. And we really became, emergency management really became sort of an all hazards type of structure, and continued to build and continue to refine. So we have a very strong emergency management division here as part of the Pinellas County government. Their mission is to prepare for and respond to natural and man-made disasters. And they are our liaison between the local communities, the state emergency management, and federal, which is FEMA. And that's an important relationship. So the bottom line here is both the state and our county have very skilled, robust emergency management organizations. The lines of communications and the partnerships were well established before this crisis. Now, the circumstances of this pandemic are quite different, but the structure is in place. And that's good news for us tonight, because we're having to revise to meet these particular circumstances, which are unprecedented in anybody's memory. But the emergency management structure, the partnerships, the communication is strong. We're not having to reinvent the wheel. One other thing I want to mention about first responders. We have a very unique situation here in Pinellas County. Now, we have a lot of different jurisdictions. We have Clearwater Fire Department, Largo Fire Department, Pinellas Suncoast Fire Rescue, St. Petersburg Fire Department. We have about 20 plus jurisdictions, the Sunstar Paramedics. And here's the good news. We operationally function as one. So we have one 911 center. Our operational plans are exactly the same. Every paramedic in Pinellas County works for the same medical director, very talented physician. And so our medical direction for this crisis is consistent wherever you go in Pinellas County. We will have a county-wide consistent response. We will be able to deploy resources to the areas that need them most and distribute those resources to the areas that need them the most. You know, I mentioned our medical director. Here's what I think is some very positive news. He has colleagues all over this country. He's in touch with his colleagues in New York, Washington State, California, and even Italy. Very, very hard-hit areas. And we are learning from their experiences. And we are taking those lessons and building them into our preparation and our management planning.
I think one of the great things Scott did for me was he actually started sending me, or having someone send me, the emergency management report that comes out almost every day, literally every day, maybe twice per day, that sort of let me know literally what you're talking about in terms of the number of things that are being thought of. And it wasn't just, as I read the report, it's not just the medical and emergency first responders. They're talking about how do we help businesses, how do we help schools, and making sure that there's child care for the first responders. It was just neat to look at the whole list of things that you're providing in terms of emergency management, what they're seeking to do for you, and what you guys are seeking to do for us. So our thanks actually goes out to you for what you guys are doing to help us be safe. Richard, one of the things we were talking about was the whole idea of the current status of first responders in Pinellas County, to look at that and say, if I need help in my home right now, and whether it's COVID related or not, what happens? I mean, I know in the past it's always just call 911 and you guys show up in a matter of moments, fast response times. What's different now?
Actually, nothing's different with the process. So this is an excellent opportunity for me to tell you how the system works. So if somebody calls 911, you're getting answered by the regional 911 center in the Pinellas County building, and they're going to ask you a series of questions. They're going to verify your phone number, your address, and what is the problem for the day. After they verify what your issue or question or problem is, they're going to ask you some set questions. Now, what we want you to do is just answer the questions and be honest with us. There's no reason to not tell us. If you feel that you are a COVID patient or have respiratory issues, please tell us. That just helps us prepare with our response. The whole time that you're talking to the 911 center, the fire rescue unit and the Sunstar unit are dispatched to help you. Now, the big change in the system right now is for our safety, we're showing up with goggles on and masks on and gloves on. So that's our initial response. Like Scott said, everybody in the system is in this together. Everybody receives the same medical direction, but there is absolutely no change in how the system works. And your first responders are there for you, and they are responding every day, several hundred times a day to take care of you. So the fire rescue unit will arrive, the Sunstar Paramedics unit will arrive, they will assess you. A lot of times they're only going to send one person into the house, or we're calling it a doorway assessment. They're going to make a determination if you need to go to the hospital, and if they need to put on more specially protective clothing to protect them from any virus that could shed from you. They may add a gown, booties, and they may put a cap on their head to protect their head. You got to remember, this is a virus that sheds, so it's not aerosolized, but it's airborne in droplet format. So they're going to put a mask on you, and then they're going to bring you out to the stretcher. They're going to try and walk you just for comfort and ease, and you're going to sit down on an ambulance cot that'll have a yellow blanket on you. You're going to get wrapped up in that yellow blanket. You're going to have a surgical mask placed on your face, and then they're going to take you immediately to the hospital. All hospitals are open. All hospitals are receiving 911 patients. So they are just as prepared as the EMS system is. And we have had many, many meetings and teleconferences to make sure that the system is in place and they are prepared just as well as we are. So I can't stress enough to be honest with the first responder, so the first responder can have their proper protection on, and they can also guide the care that is necessary for you and get you to the right location so you can be cared for.
So you're saying if you're symptomatic right now, you would want to let that person that's walking up to the door to sort of be the screener, let them know that you have any of those symptoms so they can prepare.
You want to tell the dispatcher that you're symptomatic and what those symptoms are. It could be gastrointestinal issues. It could be breathing problems, a fever, a cough. Those notes are put into the call, and the people responding to your home see that information. That's all typed in real time, and they're reading those notes before they arrive. And then the second barrier is when they do that doorway exam. You want to, again, say, stop, this is my symptoms, this is my problem, and then they can make an adjustment of if they need to put on protective clothing or not. Otherwise, they're going to come right up to you, and they're going to take your pulse and blood pressure, check your breathing and your lungs, and they're going to make sure that you're okay. Take an EKG, and if you need to go to the hospital, we're going to take you to the hospital.
Yeah, I think that's the important message to hear, guys, is that no matter what, they are coming in. They're going to come in to find out what's going on with you. There's nothing that's going to stop them from coming in. They're just going to maybe delay for a moment to be able to hear what's going on inside the home so they can gear up properly to come into your home to help the person that needs the help at that particular moment. What happens, Richard, if, let's say, somebody decides not to tell you? What happens to the people, the EMS people that arrive? What do they have to do if they walk into a room and they now find out they haven't been told that there is potentially symptoms in there? Is there repercussions for them?
So there is. You're putting the first responder in danger if you're not telling the truth or being honest with all of your symptoms and how you're feeling and for how long that you've had the issue. So the first responders will have goggles and mask and gloves on. But you got to remember, the coronavirus 19 is a droplet protection process, so that's why they put the gown and the booties and the hat on. If for some reason that they didn't get all the information or the situation changes dramatically, somebody could change right in front of our eyes.
Right.
What we do is we take those first responders out of service. The vehicle that they're in gets fully deconned, wiped with a peroxide process that kills the virus, and then the employee is sent home to shower and get cleaned up. Then they're going to be followed by the Department of Health for 14 days to make sure that they don't have symptoms. If they have symptoms, then they would get tested for the coronavirus to see if that exposure happened. The Department of Health is labeling risk levels as low, medium, and high. So just our everyday work with the mask and goggles and gloves, that's a low risk situation. But if we have a failure on our equipment, if something gets splashed on our eyes or past the goggles or past the mask, that becomes a high exposure, and then they are quarantined for 14 days and also waiting for the patient or the source patient to be tested.
So you hear the importance of why you need to tell the truth as they're coming up. What we don't want to have is a burden on the system that causes them to end up having to pull people out from being able to serve us from the EMS perspective.
Yes.
All right. Thank you. Scott, one of the things we've also talked about was the whole idea of the safer at home process right now, social initiatives. One of the things that they actually said is they would love to do this interview as long as they didn't have to sit near me.
Yes.
So we're trying to model for you what social distancing looks like. Tell us a little bit about the safer home and whether this is actually helping.
So that's a great question and a very timely question. Richard, when we first started talking about this almost a week ago, I spent a lot of time wondering how could we explain safer at home and social distancing and the benefits. But as we sit here tonight, there's actually some pretty good news that's starting to emerge about these initiatives. You see, the issue is the rate of rise. My friends, the numbers that we see every day, when you get out of bed in the morning, the first thing you see is this many infected in the United States, this many in Florida. Those numbers are going to continue to rise. There is no one looking at this pandemic who thinks that this incident has peaked and will start to wane in the next week or so. As a matter of fact, we feel like here in Pinellas County, we're on the verge of seeing a significant uptick. But it really, those numbers are going to continue to go up. The issue with safer at home and social distancing is how fast, how many per day, and it's called slow the spread. As of yesterday, Dr. Anthony Fauci, head of the National Institute of Allergy and Infectious Diseases, now he's become the face of the federal response. He's the gentleman with the spectacles, very well-credentialed physician, very calm, and I trust his opinion very much. And he has stated that these initiatives definitively work to slow the spread. And he pointed to examples in other countries. And then interestingly, just as of today, we're hearing promising results from similar initiatives coming out of Washington State and California. Their epidemiologists are saying they have effectively flattened the curve through their safer at home and social distancing initiatives. And then again today, we found out that the epicenter of Florida, Broward County and Miami-Dade, even though half of the state's COVID patients are located in those two counties, they still have bed availability above, hospital bed availability up above 40%. And today our governor attributed that to their safer at home initiatives. So we know these will work. But if that's not enough, let's just apply a little common sense to this. Whatever the numbers are today, whatever the numbers are going to be, think about what they would be if we were still mass gathering. And that's a difficult scenario to think about. With this rate of rise and slow the spread, what are we talking? We're talking about time. Time has allowed us to prepare. And Pinellas has used this time wisely, and Pinellas is prepared. Now, I don't want to end this question without acknowledging who I feel are the unsung heroes as we work our way through this pandemic. Our unsung heroes are those who are doing the right thing, practicing social distancing and safer at home initiatives. They're being responsible even as they face extreme personal hardship, economic hardships, separation hardships. We can't visit our loved ones in the nursing homes and the ALFs. Folks who are trying to balance their work at home with being their child's teacher. All those who have been profoundly affected and yet are committed to being responsible. We want to say thank you. We want to say stay the course. This is working. It's already bought us time. And as we'll talk here in a few minutes, I think it's going to have a much bigger impact on the outcome in Pinellas County.
One of the things you were sharing as we were talking just before this was thinking about your neighbors, right? So especially as us as a church, you always maintain your safety. That is a priority. But at the same time, you were talking about shopping for people that might be more at risk as a possibility. I just thought that was an interesting thought that, you can reach out to a neighbor that's near you that maybe you know is a little bit more susceptible. You do not come into contact with the person. You make the phone call, find out what they might need at the grocery store. If you're already making a groceries trip anyway, you pick up the items they need, you drop them off at their door, ring their doorbell, and walk away. And that might be a great way for our church to be present for people that are living right next door to us, people that we know and love already. Whether they're part of our church or not makes no difference. I just thought that was a powerful little story you shared, and I appreciate you sharing that as well.
Richard, that is such an important point. There's so much that we can be doing, but let's be clear. Our most vulnerable group is age over 65 and or a pre-existing medical condition such as diabetes, heart disease, lung disease, or any condition that causes one's immune system to be compromised. My friends, it is imperative that this vulnerable group truly isolate at home. And so then it falls upon the rest of us to do what we can to make sure they're able to stay in their home as we work our way through this pandemic. And again, we know you're going to have to go to the store. My family is really shifting towards home delivery, but we're combining orders.
Right.
You can do that for your neighbor. Just add their order onto yours, have it delivered, or if you're going to the store, pick up some items for them so that that vulnerable group really can stay at home and isolate and be safe.
Thank you. So Richard, you talked a little bit about some of the symptoms of corona. What should I do if I have it or somebody in my household has some of those symptoms? What should I do?
So if somebody at your home is not feeling well and you think that they have corona, because trust me, a lot of people think that they have corona when they have the flu or allergies. The goal is to take your medicine as your doctor has prescribed you and the typical over-the-counter acetaminophen for fever reduction, things like that happen. One thing that we don't want you to do is don't go to the hospital. If you're able to maintain yourself at home, and that's proper eating, proper hydration, and get rest so you feel better, that's what we want you to do. But if you might have coronavirus, we want you to reach out to your physician. Your physician's going to ask you several questions, and they're going to make a determination if you need to be tested. Not everybody gets tested that wants to be tested, so you have to fit in a certain category that the CDC recommends for testing. And then they'll send you to a location. There are many locations in Pinellas County that are doing the nasal swabs and sending them out for testing process. But during that time, you got to make sure you isolate yourself. So you don't want to go out and walk, or you don't want to go to the grocery store. You want to be the one that isolates even more from your family and from your friends, and segregate your living style. So stay in your back bedroom. Don't share the bathroom. Don't share personal items. Wipe down the counter. If you had to go out to the kitchen and make your lunch, make sure you wipe down the counter. Everything that you touched, you want to take those extra few minutes just to prevent so you don't spread it to your family. They're telling us that it's a 6-foot rule. So a 6-foot circle around you is your zone. So you don't want to come within that 6 feet of somebody else. So just good guidance, good common sense factor, and wash your hands, wash your hands, wash your hands.
Absolutely. It's funny, I had a conversation with one of our church members who was talking about her and her husband, and they don't kiss anymore, which is sort of sad. But at the same point, you get it, right?
Yeah.
It's like, if you got a little concern, especially if you scratchy throat or something like
Yep.
that, you actually take the moment to say, we're going to stop that for a little while. It's important for one of us to be healthy in the midst
Yeah.
of what we're going through, because you might need to be able to care for the one that you love so much. I think that sort of ties in. We've talked a little bit about it in terms of what we can do as a church. Is there anything else you can think of?
Well, I think what Scott was saying, by helping your neighbor, just remember, help your Anona family and help your neighbors in your neighborhood. Really important that you practice and model safer homes. So if your neighbor is walking up to you, take the time to say, hey, hold on, 6 feet, please, just for safety as you're having a conversation on the sidewalk. Just simple things like that are very, very important. I know Anona.com is going to have areas that we could volunteer at and maybe make a difference to somebody in our community that has a need. So stay tuned to that also.
Absolutely, guys. So if you do go to Anona.com ready, you'll find some resources available for you. Just go to the Anona.com website, and Leslie set it up to where there's boxes right at the top of the homepage for you to be able to click on that gives you opportunities to say not just where can I worship, not where can I be a part of a class, but ways that you can still continue to serve the church.
Yep.
And you can do that through the phone teams. You can do that. We have a delivery team. So when Scott and Richard are talking about that idea of home delivery, we've got some of that going on as well. There's just different ways that you can help out even now, even in the midst of being shut down in terms of your homes. And I'd also want to lift up in the midst of this to realize it's not just about the disease. It's about I'm wrestling with the sort of idea of social distancing.
Yeah.
That's not the word that I would choose if it was me. We are doing physical distancing.
We're social connecting, but maintaining a physical
That's
distance.
it,
Yes.
right? So how do you maintain a physical distance from one another while maintaining social connection? And I think that's the important thing. We're really trying to do that as a church. We're trying to communicate. We got the devotionals going out. We got the classes, the worship services, so many different things happening. The phone team, just trying to figure out how can we stay connected as one. And I would really lift that up as an important health issue and a spiritual issue for us as well, to say, you need that connection. And so don't be afraid to pick up the phone if you need to talk. The church office is open during office hours, not in terms of doors, but in terms of phone calls. So you can call the church if you need to talk to somebody. We've got that phone team that you can connect with. Make the call if you need help, if we haven't reached out to you yet. We're here for you. Let's turn back to you, Scott. In the midst of all that we're going through, I think there's a lot of information out. You've heard about Facebook and Twitter and things like that some people are putting out false information. Where do I go for the information that's true, that's right, good, and true, that I can trust is, doggone it, that's the reality. I need to listen to that.
All right, great question, and I'm going to answer that in just a second. I want to build on what Richard said. I think it's important to get out. I think it's important to get out, get some fresh air. The weather has just been beautiful for your own emotional health, if you will, and physical health. It's great to get out of the house. But it's so easy to kind of fudge that social distancing. Folks, the sidewalk is 3 feet wide. So Chris and I have been walking every evening, and it's awkward. You come across somebody else, but look, somebody has to step out into the street. We can't fudge this 6 foot distance because the social distancing and the safer at home are so critically important to what comes next. So that's becoming the new norm. Please try and get over the awkwardness. Everybody understands it, and truly maintain that 6 feet. So information, where do we get information? Well, let's talk about where to be careful about getting information. Folks, please be careful with social media and the internet. Times like this, we see the best in people. We also see the worst.
Right.
There will be, and already are, I'm sure, no shortage of scams out there trying to separate you from your money. There are no vaccines to be purchased. There are no home test kits at this point that you can purchase. There are no magic mix of herbs or medicines that you can purchase to fend off COVID-19. And I also want to caution you to be very careful about people soliciting money for first responders. Make sure you do your homework and check that out, because we always see those scams this time of year, and they'll phrase it as healthcare workers and first responders. You really need to do your homework and check out those organizations. So use caution with social media and the internet. I spoke to you earlier about Pinellas County Emergency Management. Well, that's PinellasCounty.org, and then just link to the emergency management page, and there is information specific to our communities with reference to COVID-19. And in addition, the county emergency managers have opened a Citizens Information Center. Do we have that graphic? Are we able to put that up? That is a phone number. If it doesn't come up on the screen, we'll make sure that that is on the Anona website.
Where it is on the website. So we have a whole web page that's dedicated to these. The things that Scott's provided in terms of the information that he's lifting up right now, anona.com/ready, it'll be there.
Very good. And then there's floridahealth.gov. That is the state emergency management organization. And of course, cdc.gov, Centers for Disease Control. There is quite a lot of information on their website. We'll answer quite a lot of your questions. Those are all really good, and we wanted to kind of get it down to a few where people could go and get good, safe, accurate, reliable information. And then I also want to lift up the Anona Counseling Center. There is so much anxiety out there, and this isn't going to end anytime soon. So we need to be socially connected with one another, but we also need to be aware of the resources that can help us out when we just need that extra boost. And so I would refer to the Anona Counseling Center for that as well.
Thanks for that as well. One of the things we're looking at right now, hopefully next week or so, we'll actually have another page, wonderful page on the website, sorry, Leslie, that's going to be our Legacy Center is actually working on trying to say, how can we help people through this moment in terms of anxiety and stress, and what's some disciplines we can practice to help us to address those for ourselves. So I think it's a great tool for us to be able to have. I know that based on the reports that have been sent to me, thanks to your connection, that we've cleared over 100 people now with COVID here in Pinellas County. We've had several deaths, and I'm wondering, what is the status today of the pandemic in Pinellas?
So the status in Pinellas, and this was really getting to the heart of why we wanted to have this evening together, to talk to you about Pinellas County specifically. And hopefully we've been able to build a little framework for you in terms of the resources that have long been in place, because we are a state prone to hurricanes, and that mechanism is strong and it's robust, and we have been given time to prepare, and that time has been used very, very wisely. As of today, April 1st, there are now 170 confirmed cases of COVID-19, with 45 hospitalizations and 5 confirmed deaths in Pinellas County. You know, it's easy to look at those as numbers, but each one of those represents a person, and each person represents a family. These numbers will continue to rise. It's so important that we don't allow rising numbers to discourage us from staying the course. Our median age in Pinellas County is significantly higher than the counties around us, and that is going to factor into what will be difficult numbers. As we mentioned before, it becomes imperative that we protect the most vulnerable. We've talked a lot about how we've prepared for hurricanes, and I think quite a few people watching will have experienced at least one, if not more, natural events where you may have had to shelter or make arrangements to move out of your home. So I'm going to use a hurricane analogy to talk about what we think is going to happen in Pinellas County. So if COVID-19 were a hurricane, Pinellas can say this: we're going to take a hit. The trajectory is pretty certain. But we don't know if it's going to be a Category 1 2, 3, 4, or 5. We don't know that. But I will tell you this, if it's anything less than a 5, it will be attributed to all of us acting responsibly with the Safer at Home and social distancing initiatives. And I will tell you that at least one media outlet is reporting that Pinellas has a very high compliance rate with these initiatives. Way to go, Pinellas. Our neighboring counties, not so much. But for the most part, we're acting responsibly, even when so many are facing extreme hardships. You're still doing the right thing. It's so important that we stay that course, that we try to minimize to the extent possible the impact that this is going to have. We feel, our emergency planners feel, that right now we are in a calm before the storm, and that we're going to see numbers in Pinellas County rise uncomfortably. Pinellas County is prepared. Your first responders are there, and when you call, we're going to come. The hospitals are ready. The emergency management structure is ready. Our paramedics are ready.
Scott, I love the analogy of the hurricane. And it's sort of neat to think of it from the perspective, normally a hurricane we've got no control over. We don't know where, how it's going to land, where it's going to land. And we actually, what you're saying is we get to control the eye of the storm. We can say whether that thing comes straight into Tampa Bay or not by whether we practice things like social distancing. And what we can do is if we actually practice these things, it will actually steer it back out to sea as much as possible and glance against us rather than run into us. I think that is a great analogy for us to sort of think of and think through in terms of how we practice safety for ourselves and for our friends, our neighbors, and our emergency response teams. Richard, as he's finishing up, we're getting ready to move to pretty much what's our last question to discuss tonight. I want to lift up to you all that if you're interested in asking a question, we have Leslie over here monitoring on Facebook, so if there is a question, we'll address that after this. If not, it's okay, but if you do have any questions, feel free to ask. She'll check them out, see if we can get them up to us, and we'd love to respond. But why don't we just jump into the last question, Richard? And that is sort of a sum up, I guess, of a lot of what we've been talking about.
Right.
What is it that Pinellas County is doing to prepare for pandemic?
Pinellas County is doing a lot of work over the last several weeks to get ready, really to get ready for today. It's here. We're operating within this pandemic every day right now. Over a week ago, maybe 2 weeks ago, Pinellas County EOC opened up. So that's our emergency management partners opening up a whole floor of people coming together from different disciplines to make sure that we're taking care of our whole community. And it's not just silos of EMS and fire, the health department, the homeless population. This brings everybody together to the table so they have a coordinated effort for the responses. So our emergency managers and our EOC are going strong and coordinating our local efforts here in Pinellas County, but also with the state of Florida and with the federal government to make sure we have the supplies and we have the latest information to be able to use that in strategically planning what our day is going to be and what our next week is going to be. A couple other things that we're doing is our medical director, Dr. Angus Jameson, he is the EMS medical director. His fellow in college is a ER physician in New York City. I know that he has talked to him actively several times this last week to see what they're seeing up in New York, just like the West Coast and Washington State, where it first started in our country. Everybody is learning lessons from town to town, city to city, and how did they handle it? That's why we keep talking about Safer at Homes, because that is your opportunity to make a difference for our community just by being at home and the social distancing or the physical distancing, and we still do the social content of our life and for our mental health. But that's going really well. So Dr. Jameson has done a great job leading a group of people along with Craig Hare from Pinellas County EMS and Fire Authority, bringing local leaders together, and there's a command structure. where there's a group from myself from Sunstar Paramedics, Chief Slatterer from Pinellas Park Fire Department, Chief Womack, City of St. Petersburg, the Medical Director, County EMS Authority. And this group is doing forward-thinking planning to make sure that we have the resources and the people in the right place, basically, as the system changes. Currently, it is calm, just like Scott said, but we are prepared for it to get busier and busier. But with your help, it's not going to become too busy for the system to handle. We have a lot of resources here, and they're all coordinated very, very well. We're taking in the lessons learned from New York City and from Washington State and applying them here in our planning meetings. But we have the overall operations group, but then we are broken down into workforce protection groups, decon groups. How do we best decon an ambulance or a rescue truck after we transfer somebody? Because we don't want cross-contamination to happen. We're also telling our employees how to protect themselves with their families and what's the right thing to do there. So that's really going well. A lot of effort is going into PPE. You know, you see these stories about hospital nurses and doctors wearing the same mask all day or 2 days in a row, and they're sterilizing them. I got to tell you, the folks here in Pinellas County have done an outstanding job procuring PPE for our first responders. We're doing well, and we have several layers. So if one product runs out, we have a backup. If that product runs out, we have another backup. So we are prepared for the long run on this. We're hoping for a short run,
Right.
but we're prepared for the long run, and we continue to order supplies and receive supplies from the state stockpile and the federal government stockpile. So our systems are working really well, and we're seeing things come through. We're testing, just so you know, we're testing different styles of rescues and ambulances to move a COVID patient. So if we have a confirmed COVID patient, we're going to send a specialized vehicle. So they're 3-person teams. The back of the truck is set up. Everything is sealed off. The exhaust is on, just to make sure that we're not bringing a positive person into an environment that could actually contaminate somebody else or something else. So a lot of care and time and preparation for those calls. And remember, we really slow down a lot. We're a 911 system where it's lights and sirens, but on those type of calls, they're very diligent. They take their time and they follow a process. We have safety officers watching every move and making sure that we're moving people safely, but we're also deconning safely. As the system learns more about the virus, you know, this information that we're getting out of New York City and different protection plans for the people, we're monitoring it every day. And that goes into these work groups of professionals to make sure that the right information is getting out to the community. We go back to safer at homes. It really comes down to that. I mean, that is working. It is showing that it's working in California. It's showing that it's working here in Pinellas County in the state of Florida. And we want you to remember that. These are the things that you can do to flatten that curve, as Scott said earlier, and make a difference for our community. And the pain of being physically restrained from what you're doing every day and you're not going to work will stop sooner if we all do that. I got to tell you, the hospitals are prepared. I am on a hospital work group. I physically went to a couple emergency departments today. They are prepared to receive sick people. They're doing a wonderful job making sure everybody's protected. They have the capacity at all of the hospitals. All of them are open in receiving patients. So it's very important that we talked earlier that you tell them what your symptoms are early so they can prepare and protect themselves, but also protect you from anything. Surge options, such as ambulatory care centers. You saw in the newspaper that the Yingling Center in Tampa, hotels in Tampa have been reserved. Pinellas County EOC has done a wonderful job getting ready for a surge if it happens. And they have strategic places that are not being mentioned right now on purpose that will be used for surge capacity. The plans are in place. If they need to activate those plans, it'll be a smooth operation. But everything is falling into place very, very well because we have this time and we have this experience of planning for these emergencies. It's going to do really well if it has to be enacted. So I'm very confident in our emergency management operations plan for those things. You added in here a method for evenly distributing patients. So
That
is
would be Scott.
So that speaks to surge, and if one small area of our community, Richard, were to experience a large number of patients, would we take them all to the same hospital, or is there a
No.
mechanism countywide to know who has availability?
So Scott, as you know, we practice this every day in our normal 911 system. So if we have a surge issue that happens, we have a network of hospitals and that communicate with our medical director, and we know what their capacity is. So if a hospital becomes surged or over capacity and they're having trouble caring for people, they report it to us and we'll know about it. And we divert people to the locations. We will drive further to make sure they get to the care appropriate. We don't want a hospital to receive too much too fast. And so we are very fortunate. We have 12 fully operational hospitals here and 6 freestanding hospitals in our system. So that's 18 911 receiving centers that are available to the Pinellas County residents. And I got to tell you, it works well, and it's exercised every day. So it's a great segue with that. We're talking about all the different people that we take care of every single day. So the first responders come in contact with all of our residents. So going through the homeless population, the homeless population has many different outlets to be cared for, and making sure that they're in safe locations and that they're not spreading the COVID-19 virus. And I am not aware of any virus or somebody who is tested positive for the virus in one of these homeless populations like Safe Harbor that is run. So that's really good news. So their hygiene is going well. Their screening process when people come in is going well because they ask them the same questions. They're taking temperatures, and they're protecting that at-risk population. So that's very good. The school system is doing a phenomenal job trying to do online teaching, but we understand that the stress that causes in a house trying to educate your family members is different. But when it comes to the 911 center, our EOC, our county government, you can see pictures out there of what a paramedic will look like normal, and then what will a paramedic look like with their gown, mask, and cap and gloves on. There is difference, same people, same equipment.
Right.
It's just a different way of applying their tools to the trade and taking care of you. So it's just really, it's really important that you understand that. The economics of our community, it's difficult. You know, it's difficult. Scott, you put that in here to touch base on. What were you thinking in that area?
Well, in terms of the economic, I just wanted to point out that that is part of emergency management planning. And in this particular situation, the economics of it are particularly difficult.
Yes.
But that is part of emergency management planning. We see those in the situation reports that come out every day. There are working groups. And again, the partnerships are already put together. The lines of communications are well established from previous efforts on the emergency management part. And so our business leaders and our economic leaders in the county are all part of this planning. So it's not just how do we take care of sick people. It's literally looking at every aspect of life.
Yes.
Because every aspect of life has been impacted.
It sure has been impacted, and it's important that, you know, your words are absolutely correct, that the lines of communication are built and everything's been tested already. We are physically testing every aspect of our plan in small amounts to make sure everything is working well. And I got to tell you, all the results are coming back really, really positive for the first responders. You know, every aspect of our job has been tested and doing good.
I think that speaks to the diligence you guys are observing in terms of trying to keep this from spreading amongst your own teams and then from your teams to others.
We didn't start planning for this 2 weeks ago. This is Scott and I have decades involved.
It's
here.
like your job, right?
Yeah. We care about it every day, so it's really coming together nicely. Did we get? I don't know if we have any questions that came online, but I just want to say to close up this question. Tonight you heard a lot of positive thoughts about how the system is designed and how it's operating, and all the different people from myself to Chief Magness from Clearwater Fire Rescue work hard every day for you. Please know that Safer at Homes works. Positive attitude, help your neighbor, help your friend, and it's going to go a long way. We will do well with these efforts that are going on.
Absolutely. And we do have some questions that have come from Facebook. So, Leslie, what do we got?
Hi, everybody. Thank you so much for being here tonight. We've had overwhelming responses online that everyone is so appreciative of you taking your time to be here tonight. So 2 of our top fans on Facebook have submitted some questions, and then we also have questions on our chat room at live.anona.com, so I'll get to those too. So our first question is from Candace, and she wants to know, do you expect testing to become more widespread, basically to start testing on others, not just those with symptoms?
So the question is, do we expect testing to become more widespread and possibly extend to those who don't have symptoms? And the answer to that is absolutely. I cannot speak to the time frame, but we spoke earlier in this conversation about the gift of time. The social distancing and the Safer at Home initiatives have given Pinellas County the gift of time. And I heard Dr. Fauci say today the top experts in the world are working on this issue, and the top experts are working to develop advanced testing. And I heard the governor say today that testing kits, which take less than 15 minutes, may have already been shipped out to various parts of Florida. So the testing is destined to catch up. And that will be absolutely the key for us going forward to maintain the progress that we've been able to achieve through the stay-at-home initiatives. I'll build on to that by saying that there is a lot of talk in the media about whether this could be seasonal. The science isn't there yet. We don't know. Many coronaviruses are seasonal. And there is speculation, could we see a resurgence in the fall? That's a true concern. But that will also be that much more time that we have to develop testing capabilities, rapid testing capabilities, the ability to do serological testing for antibodies, and a resurgence. It's going to have to be taken seriously, but that situation may possibly be handled very differently from the ability to rapidly test and quickly isolate those breakouts.
I think that's huge. When we're talking about flattening the curve, I think that's the big issue, right? That's the time issue of being able to stretch it out long enough for us to be able to have different things like the tests be able to come up, therapeutics to be able to come out that can help you to at least mitigate some of the symptoms that are associated with this, and hopefully get to the place where we'd have a vaccine at some point down the road, which obviously they're talking about next year.
Exactly.
Leslie?
Jason asked 2 questions. Is there a shortage on protective gear for first responders in our area? And if so, how can we help? And he also wants to know if we should all be wearing face masks.
Richard?
I'll go ahead and take that one. Yes, there is a shortage of personal protective equipment. Our government structure is doing really well. We are currently, everybody has PPE to use, and there is several weeks worth of equipment available. We do have a lot of people trying to help us, so it's important to understand that the equipment that we have is tested, scientific data behind it, and those letters and numbers mean something. So an N95 mask is an N95 mask. A KN95 mask is not an N95. So they are designed for different things. There are places in Pinellas County, one in North County and one here on Walsingham Park, that are accepting PPE donations. I'm not exactly sure what Pinellas County government is doing with that, but I know they're going to help people in the system to make sure that they're protected, that maybe in the mental health area that doesn't have a lot of funding and didn't have a lot of supplies before this started and before they became scarce.
I also heard today, once again, on the report that came out, that Baycare has authorized a company to produce the plastic shields.
Yes.
Plastic shield mask, and that they'll be producing, I think, somewhere in the neighborhood of 1,000 per day.
Yeah.
And that's, I'm going to guess, be Pinellas specific.
That's just going to help everybody. Yeah.
Right, absolutely. The other question was about masks and whether we should be trying to wear them now.
So that's a good question. The CDC, I believe up to today, said no, it wasn't necessary for a healthy person to wear a mask. But today there was some indications that that may change to help flatten that curve more. I believe Scott has a little bit better information on that than I do, more up to date.
So that is a very timely question, and it is being discussed. I heard the Surgeon General this morning talking about this very subject. And interestingly, the question came along in terms of could we use a scarf or a bandana to wear over our face and our nose while we're out getting our essential items like groceries. Interestingly, we don't know if that will protect you from getting the virus. There are many different cloth materials. It's not tested, and so nobody can say with any certainty that it would absolutely prevent you from getting the virus. But here's the new line of thinking. 25 to 50% of COVID patients never experience symptoms or very mild symptoms that they don't attribute to this. And so they are potentially shedding the virus when they're also out in public. So the advantage for people to start covering their mouth and their nose might be that we prevent carriers from spreading the droplets that Richard alluded to earlier. And so the CDC is, in fact, rethinking this recommendation. Now, there are two strong caveats that go along with this. First, please, if you have access to N95 masks, we would prefer those go to one of the drop-off points that Richard just mentioned so they could be used by healthcare professionals. So it is very important that we're having trouble keeping up with these N95 masks for healthcare workers in the country. There's no possible way they could be distributed to every citizen. So if you have access to those, we would prefer those be donated to the healthcare community. The second caveat, and very, very important, if you cover your mouth and your nose, it probably falls under the category of might help, certainly can't hurt, but please do not develop a false sense of security. You can't cover your face with a scarf and then be within 2 feet of other people. As long as you're maintaining what our government and our local emergency managers are asking, social distancing, that's 6 feet, and safer at home, as long as we're following those initiatives, then certainly covering your mouth and nose could bring some potential benefits. If nothing else, it might prevent you from getting the virus on your hand and then touching those areas of your face.
Thank you, Scott.
I think we also should talk about the different types of masks. So you can get a dust cover mask from Home Depot. Okay, it's a dust cover. That's what it's designed to do. A surgical mask is designed specifically to keep you from breathing out bad germs into your area. And the N95 is specifically designed so the first responder doesn't breathe in the area or environment that they're working in. So it may look good, but they have very specific jobs to do in protecting us.
That's good to know. So if you do have those N95 masks anywhere in your home or business that you don't need to use, that would be a great thing to get out right here at Walsingham. I think it's Walsingham Park.
Walsingham Park.
Walsingham Park.
That you can just drop those off, I think, through the course
And
of
in
the whole week.
particular, we'd ask people to think about medical offices that are closed for the time being and dental offices that
yes.
are closed. there are probably a lot of facilities that would use these type of supplies that are now in a closet somewhere, and I think that's what we're looking for.
Leslie?
So now we have a couple of questions from our folks that are at live.anona.com. The first question is from M.E., and this is just, in your opinion, does Pinellas County have more retirees than other areas in Tampa Bay? And if so, does that put more strain on our resources for taking care of that type of community?
Okay, so we can answer this in a couple of ways. The median age in Pinellas County is about 49 years old, and that is certainly higher than communities around us. I can't really compare it to the state, but I know compared to Hillsborough, our median age here is significantly higher. So one statistic that we are looking at, which is a little concerning, is that Hillsborough currently has twice as many COVID cases as Pinellas County, and yet almost an equal number of hospitalizations. And so we have to ask ourselves if that may be a product of a higher median age here in Pinellas County. And that's why we said earlier, it is so important for us to all help out that more vulnerable population. They are at serious risk of developing serious complications from this disease. They are at a much higher risk of needing an ICU bed as the disease progresses. And so it's imperative that we isolate them and prevent the virus from taking a hold in the first place.
Yeah, I'd say for our retired population, please hear everything we've been saying, which is stay in your homes as much as possible, and that as a church we can maybe support those people by going shopping for them.
So interestingly, when we break down by age groups, whether it be the state or Pinellas County, and we see who is currently in the hospital, it is those higher groups. But as you get much past 80, 85, the number goes down. I think those people are staying home. I think they get the message, and nothing we've said here tonight should in any way imply that young, healthy people cannot have serious complications from COVID-19. We know that. That's one of the lessons that we're hearing from places that have already experienced surge and whose healthcare systems have been taxed. And so it becomes vitally important for all of us, every one of us, safer at home, social distancing, wash your hands.
Absolutely. Yep. I think, once again, the report that you sent went down as low as 15 years old of somebody being reported with COVID in our area, and the scaling all the way up into the 80s. Leslie?
Or it's actually a fact or fiction question from Kathy. She's heard that if a person drinks, she's heard this twice actually, if a person drinks hot liquids every 20 minutes, that it helps if you have a virus, that the mucus doesn't harden in your lungs. Is that fact or fiction?
Well, I'm going to go with a hard fiction.
I agree.
Look, we have Dr. Angus Jameson is our county emergency medical services medical director. Very, very talented physician, very, very well connected. We're on live chats with him twice a week. And one of the things that we're getting from that is the fact is we really don't know a whole lot about this virus. And we don't know. We know that the older people and folks with comorbid medical conditions are more vulnerable for the severe form of the disease. But we're not exactly sure what the mechanisms are there. I would say, you need to drink clear fluids to stay hydrated. Certainly you want to stay hydrated. I don't think there's any science behind the fact that would prevent you from acquiring COVID-19.
I think we got a ditto from Richard on that.
Oh, yes.
Key affirmation.
Fluids are very important in your health and making sure that you are healthy.
Leslie, let's do maybe one more. It's getting to 8 o'clock.
I was going to say this is our last question from Kathy. So she says that they're doing their due diligence and cleaning their house a lot. and they haven't received any company, so they're following the guidelines. Spraying disinfectant on doorknobs, sinks, literally everything that they touch. But now they're worrying and stressing out about the cleaning and the disinfecting the home. Is this over the top or not?
I don't think it's over the top at all. The more cleaning and wiping that you do, the better chance you have to knock down a virus if it came in some form or fashion. Now remember, the virus can come in groceries, plastic bags, paper bags, boxes from Amazon. You walked out to your mailbox and it's on the mail. So really, our message is wash your hands often every day and make sure you're wiping your touch points a couple times a day. This is a good health safety practice during flu season and now during COVID-19. So we really encourage you to keep that up, and the disinfectant is good.
Absolutely. And what was her name? Kathy. So Kathy, yes, disinfect. I've heard anything from once to twice a day. Look, it sounds like you're doing everything right.
Yep.
You're minimizing the opportunity for the virus to come into your home. Here's what I would tell you. Disinfect. Don't stress over it. Please don't stress over it. Don't disinfect so much that it's causing you stress. So when you get to that point where you think, I need to disinfect for the third time today, take a nice walk around the block instead, and just take a little time for yourself. Sounds like you're doing everything right.
Yep.
Richard said it. I'm going to say it again. Wash your hands as often as possible.
Yeah.
When you think about, if you're going to obsess over anything, I think that would be it.
Yes.
Well, guys, thank you again. Thanks for coming out, spending the night to be able to talk about, obviously, a very important issue to our community. Is there any closing comments you'd have for us as we're heading out?
Yeah, I'd like to just talk to our church family for a minute and kind of wrap this up. My friends, stay the course. Social distancing and safer at home is working. It will work. Thank you for being responsible. Your first responders are prepared, and we're here for you. Friends, we're in for a rough journey, but our community is strong. Stay connected with one another and help protect our most vulnerable. I know I can speak for Richard when I say we miss you. We miss being here with you. But we're looking forward to the day when we're once again worshiping together as a community of believers. Until then, my friends, take care, stay safe, and may God bless you and yours.
Anything for you, Richard?
I'd like to echo Scott's comments. Very important that we remember the mental health aspect of this world that we're in right now. Your social distancing really means to stay socially connected and physical distancing. Remember to take care of each other. I appreciate everybody who watched or sent in questions.
Thank you for the questions.
And given us an opportunity to spend some time with you. We love our church family. That's why Scott and I are here with Richard, and we both jumped at the opportunity to spend some time with you. Look forward to seeing you back here in this building, but just remember, Anona's not a building. Anona's a community.
Absolutely. Guys, thank you. Thank you so much. They're hitting the ball out of the park. We miss you. And based on the people I've talked to and seen, when we were doing the communion drop-off, people were picking up the boxes and just getting to have a few conversations with you all. It was touching my heart to hear the hurt at the separation between us, that we're not able to be in contact with one another, we're not able to worship together. One of the great things we're going to be doing is Maundy Thursday, and we'll be celebrating communion. And it made me think of a time when I was up in Georgia, and my family was down here, where we'd bought the house down here, and I moved them down before I finished in seminary. And there was one Sunday morning where I was having communion up in Atlanta. And I realized that at the same time that I was eating that meal up in Atlanta, my family was here sharing that same meal here at Anona. And that spoke to me. the beauty of our faith is that it brings us together even when we're not together. There's something bigger than us that unites us as one. And maybe this is just one of those moments where we realize it a little bit more. What I'd love to do is just have a moment of prayer with all of us, to be able to lift up our frontline defenders that are standing up for us and keeping us safe, and for our congregation as a whole. Will you please join me in prayer? God, in the midst of all that's going on, I just want to say thank you for Scott and Richard and for all the people that they represent. They represent the doctors, the nurses, the people that are in the ambulances, the people that are in the fire departments, the people that are in our nursing homes caring for the people that we care about so much. And God, I thank you for this church, for its desire for community for one another, but God, also for the fact that this is a church that doesn't just care about us as a community, we care about the community that surrounds us. And would ask, God, that you continue to bless us with ways that, that we can help our neighbor. We can love our neighbor. Lord, I'd ask for your watch care, your protection, your peace for those anxious moments that rise up within us, that calm would prevail, that the peace that passes all understanding would wash over us, and that we would have a confidence in our faith to be able to walk forward and to do that in the same name that we pray, the confidence of Jesus Christ, our Lord and our Savior. And we all say, amen.
Amen.
Thanks again for joining us tonight. We'll see you on Sunday morning, Palm Sunday, for worship online. Hope to see you there. Take care, guys.